My name is Tori Johnson, and today I'm going to be demonstrating an intradermal injection. This is a TB skin test for my patient. I would follow all GPSP guidelines through this entire skill today. I will also ensure all of my 11 rights to protect myself and my patient, and the 3 checks of the preloaded dose of medication. Okay, so let's get started. So I will do hand hygiene. Based on facility policy, I will also follow all of those guidelines. I'm going to identify my patient with name and date of birth. If the facility has it in armband, I would check that also to make sure. Okay, so we have done an assessment and we have come to the conclusion that the best place for this site is on the inside of my patient's forearm. My patient has claimed to have no new allergies. Okay, so let's get started. I have done hand hygiene, got my gloves on. Okay, so we will assess the skin on their forearm. I'm using this fake skin, but this is my patient's forearm. They have no irritation, nothing that would interact with the injection today or make things more painful or harmful. No redness. Okay, looks good, so we'll go in with our alcohol pad. I'm going to start with circular motions from the inside to the outside to make sure that entire site is clean. Okay, so my patient has been educated on the injection today. Okay, so we will do our last and final check. We have this preloaded dose of medication right where we want it. And with this intradermal injection, I really want to make sure that I'm getting the dermis of the skin and getting that bevel up that we need to get that medication to the top of the skin so we can get that bubble that we want. Okay, so my bevel is up and we are ready to go. I'm not going to squeeze the skin. I'm going to pull that tautly and go in at a 5 to 15 degree angle. Hold that steady and insert that injection. Okay. Very slowly, and I'm going to pull that out the same way that I went in, lock that safety, put that in the sharps. Okay, I will cover this with gauze, ensuring not to put any pressure. It's also very important that I educate this patient not to massage or put any pressure on that to interact with how the TB skin test reads for results. Okay, so once they are not having any adverse reactions apparent, bleeding has stopped, I will remove that gauze, remove my gloves, and perform hand hygiene. I will educate this patient that it is normal to have that bubble in the top of their skin to try and not mess with it or irritate it as much as possible. I will also educate my patient on when there are any adverse reactions that are not normal, when they would need to seek medical assistance, and I would also ensure that they come back 48 to 72 hours after today to get their reading on that TB skin test. I will reassess with them, make sure that their injection site looks good, make sure they're not having any reactions or feeling any type of off way after the injection today, and I will record and report all necessary information into their record and their MAR that they did get a TB skin test today. Thank you.